All right, now it is my distinct pleasure to be able to introduce our keynote speaker. And Beth is a past president of SNRS, and I have known Beth since we were colleagues in the doctoral program at the University of Texas at Austin together. So it's very special for me to be able to introduce her. Dr. Beth Collins is the Senior Advisor, Women's Health and Gender Research, and former Director of the Evidence-Based Practice Centers program at the Agency for Healthcare Research and Quality, or AHRQ. She was recently appointed as the Senior Advisor for Nursing for all of AHRQ, which is wonderful to have a nurse representing us there. Her scholarly interests are in the area of nursing research and practice, maternal child women's health care, clinical guideline evaluation, and outcomes. She received an associate degree in nursing and a Bachelor of Science in Psychology from Shenandoah College and Conservatory, a Bachelor of Nursing and a Master of Nursing degree from the Medical College of Virginia, Virginia Commonwealth University, and her PhD, as I said, from the University of Texas at Austin. She has taught at 3 large universities in the schools of nursing. She served as a nurse coordinator in the NICHD Maternal Fetal Medicine Units Network and practiced in community hospital, general medicine, postpartum units, obstetric emergency room, and a university mother-baby inpatient unit. Most recently, she served on faculty at the Medical University of South Carolina College of Medicine and as Director of Research for Obstetrics Gynecological Department. Along the way, she has served as a member of a variety of institutional review boards at various universities, chair of a university General Clinical Research Center Scientific Research Committee, president of Southern Nursing Research Society, and let me get my pages separated here, and served as team leader for the evidence-based guideline on cyclic premenopausal pain, discomfort, and Association of Women's Health Obstetric and Neonatal Nurses. In her spare time, she is the mother of 2 beautiful children, and she would not tell you, but she's also an accomplished musician. It is my great pleasure to introduce my friend and colleague. Please join me in welcoming Dr. Beth Collins Sharp.
Thank you. It's really a pleasure to be here. Thanks to my mentor and dissertation chair, I became a charter member of SNRS and attended my first conference as a doctoral student in 1988. I was reminiscing with some colleagues earlier about how we met at the doctoral student rap session. In those days, rap meant something a little bit different. But SNRS has been a wonderful society, so I'm really pleased to be back and to see you all here. All right, I am a government employee, and so I need to give you my disclaimer and tell you that I will be giving some information that comes from my agency and from my colleagues, but the personal opinions are my own. I hold no conflicts of interest that I need to divulge, and I would like to acknowledge the contributions of my colleagues who were very helpful, and I will point those out along the way. Now, last year at your keynote, Dr. Broom gave a wonderful address talking about nurse scientists as crucial partners in healthcare delivery. And her premise was that we, as nurse scientists, have a unique role to co-lead patient outcomes improvement initiatives and to leverage knowledge to improve healthcare. This was very well received, and so the Planning Committee was impressed with many of her themes, which I've outlined a few of them here, and decided that it would be nice for this year's address to build on these themes, and then, of course, they developed this title of Expanding Networks of Knowledge for Healthcare Innovations. And so my challenge and charge is to try and build on the discussions of last year. Now, I'm not sure who came up with these words. Words are important, but these are wonderful. Each one of these is an important concept, and I'd like to talk about each of them individually and include a perspective that may be different from many of yours here. Sometimes taking a new perspective, you kind of have to turn things on their heads, look at them a little bit backwards. And so I'm going to start from the bottom and give you a few brief perspectives on each. So beginning with innovation. There was a talk last year, and a lot of work has happened in the last year about innovations, a lot of it coming out of CMS. Of course, being CMS, they define it via models of care and models of payment. And their current focus is on testing new payment and service delivery models, evaluating the results from those tests, and then engaging a broad range of stakeholders to develop additional models for testing. So it's a continuous circle of development. The third point where they're engaging stakeholders, just keep that phrase in mind because we're going to talk about that again later. So as I said, they've done a lot in the last year in terms of innovation at CMS, and their website is really very descriptive of this. If you look at there's the pointer. If you go to the website, you'll see some of the recent milestones. And so just last week, they announced 6 model testing programs and some other pre-testing and design programs, of which one was right here in Arkansas. And here's where those states are. There were also 2 other in this state. So if you're from one of these states, you have new awards, innovation awards in your states that you may want to check out. If you want to see what's going on in your state, if you go to the map on the right side, I'm having trouble with the pointer, so I won't try that again. If you go to the map on the right side and point at your state, and so of course we're going to point to Arkansas, you can see all of the innovation projects. Now this is just Arkansas, and then you can see a little smattering outside of it. Pretty impressive, right? So I would suggest that you go to your state perhaps and take a look at what innovation is happening right now, just to give you some ideas. Now ARC is doing some work in innovations as well. We of course do not have the funding pot to support this, but we are doing some work in the area. And here's our definition. I'm not going to read it to you for the sake of time. But you can see that it is a broader definition. The place where ARC is doing some interesting work is on the Healthcare Innovations Exchange. How many of you heard of the National Guidelines Clearinghouse? Most everybody's heard of that, right? Okay. This is a cousin of the Guideline Clearinghouse. It's a database, searchable, for innovations. The thing that's different about innovations is that you can't have as high a bar for criteria of inclusion and testing and results. And in fact, sometimes lessons learned, attempts, and failures are just as important in innovation. And so that's what makes this website and database different, because it includes a variety of ideas, and you can search them in a variety of ways and interact. And so this is meant to be a learning portal, not just distributing information. There's meant to be interaction through this portal. They have tweet chats, they have webinars, a number of things going on, Twitter chats. Sorry, terminology is not quite right. But there are a number of interactive, remember, I'm still back in the rap session days, right? This might be something that you might be interested in. Here are 3 examples of nursing innovations that appear on the exchange. And if you go through and just pull out a few words, nurse protocols, nurse visits, immunization training, tracking, and there are several buzzwords that come to mind when you're talking about innovation, and they're buzzwords that we've all heard before. Checklists. Yeah, I remember checklists. I did those. Handoff reports. Oh yeah, right? Toolkits. I did a little trip down memory lane and looked at some of my old SNRS newsletters, and there were things that looked very much like toolkits way back when, back in the day. Care coordination, well, remember that project, or the case managers who were nurses? It's just a new name, workforce. So, of course, you know, these aren't really innovative to us. And obviously nurses get it. But here's where we fall down. We don't plan it beyond the actual simple documentation. We have a checklist, we have a flow chart, we have a cardex to document. We don't think about it in terms of research. How can we use that tool to reduce infections, to improve safety, to prevent errors? And then we don't share it or publish it. And worst of all, it's usually within a quality improvement realm, and we don't really respect it as legitimate research. So I'm going to come back to that in a little bit. So action items. Action items is a little government term that we like to throw around, which is another way of saying our to-do list. At the end of meetings or in memos, we have action memos. Doesn't that sound exciting? So these are the things that I would like you to consider in terms of innovation. And first is to find the innovation in your work. Get inspired. Find out what's going on. Get out there. Go on rounds. Look at what's going on and see what might be innovative that you could incorporate into your research projects. Perhaps go visit one of those innovation centers that's near you, or innovation projects, and just attend a meeting and find out what's going on. But all the while, keep a focus on your outcome. How is healthcare going to change because you might introduce an innovation? And what's going to be the context of that outcome or that innovation? So now let's look at healthcare. So what are the top 3 priorities for healthcare? Number 1, implementation of the Affordable Care Act, right, obviously. Number 2, the ACA. Number 3, the ACA. This is a direct quote from the halls of the Humphrey Building. We are very clear about this. Currently, that focus on implementation of the ACA is on insurance marketplaces, which we used to call exchanges. For example, states in this month just committed to what kind of health insurance marketplace they were going to use in their states. CMS is this month gathering public comment on a single streamlined application for insurance. And so soon there will be education for consumer enrollment. There is also education about benefits. I got an email yesterday about some new tools from CDC for the women's health preventive services benefits. This one was specifically related to contraception. And they just announced in the last week also about expanded mental health and substance abuse disorder benefits. So the ACA is now almost 3 years old. Your states are paying attention to this, making decisions about this. All of HHS is paying attention to this. The agencies that you want grant funding from have this very clearly as their top priority. Whether you agree with it or not, ACA is the biggest thing in healthcare to come along, perhaps ever, certainly in our lifetimes. If this is the top priority for the country right now, why isn't it your top priority for nursing research? So maybe that made you a little nervous. I hope it did, because we're almost 3 years in it. But here's the good news. We know there's a timeline. So you can go and find out what has happened in these last 3 years, incorporate in some extra data on what's already happened, and see what's going to be happening in the future so that you can get ready for it, so that you can collect your data for it. So these are the primary things that are happening in 2013. You can go to healthcare.gov and look at 2014, 2015, plan your research around that. When before have we had a roadmap like that? Never. It's full of ideas for you for research. You know that's where the money's going to be. It would be silly not to pay attention to that. So, action items. Find the ACA-related context of your work. It's in there somewhere. It's big. Have you read it? It's about this big. I've got a copy on my desk. It's much easier, actually, I got a commemorative copy just for fun. But it's very easy to read online because you can just search it. It's very easy. So take a look at it. There's a lot going on. Find out what's going on in your state or region. Again, at the same time, keep a focus on your outcome. How will healthcare be changed because of your work within the context of the ACA? Next area, knowledge. Last year, Dr. Broom suggested that these are some of the next generation of data and analysis methods. She was absolutely right. So I'm going to take her list and add to it. And we have quite then a large area of research data and strategies and analysis. But how many of those do you know? Are you familiar with? How many of them are in our curricula? How many doctoral students here are learning about these types of data and these analyses? Probably not many. I'd venture to say not enough. The challenges, though, with these data is that they're messy. Well, you know what? All data are messy. And it feels even particularly more messy because you didn't collect it yourself. There's often very little coordination with the electronic health record. There's redundancy of data collection. The same data are being collected by different sources. And there are really problems with definitions, and this is nowhere more acute than in race ethnicity. There are some federal data efforts to standardize some definitions like race ethnicity, at least within the federal data collection efforts. We're going to start collecting on gender as well. So there is hope, but those data standards exist so that the more that they're applied outside of the federal government, the better it will be. But nonetheless, we need training, or trained statisticians and epidemiologists. And I brought along, actually, I'll post it if you like, the RFA from NIH that came out, I think this week, on requests for information for training needs related to big data. So people are paying attention to this. But in these, when you talk about these data, then it asks you, what is the universe of nursing research? Is it just the traditional one-off study with the traditional data collection, single investigator? Or does it really include quality improvement, guideline development, quality measures, and these other sorts of study designs and approaches? And so my question to you is, are you going to take advantage of these new data sources? This is being figured out right now. Is this going to be like we talked about in innovations, that several years from now you're going to look at it and say, oh yes, we've been involved in quality measures for years. Nurses have been. Why aren't we leading these efforts? Is your keynote speaker in 2016 going to say, why aren't nurses at the table here? Why aren't we leading it? Well, here's our chance. So your action items. Please be honest with yourself about the data for your work. Get inspired, find a new source of data to add and get familiar with, and get out there. Find somebody who knows about it, or get somebody who's trained in it. Incorporate it into your curriculum in some format. As always, keep a focus on your outcome. What are the data for your outcome and the methodology that would be most appropriate, and how can you leverage the new data to change your healthcare outcome of interest? So 2 more sections, 2 more concepts, and they're sort of related. So networks is the next one. There are several different types of networks. And the nice thing about networks is this is a wonderful source for partnerships and teamwork. There are the traditional research networks where you design studies together, everybody collects their data, they pool them, and they fight about who's going to be first author, and then they publish it. There's also distributed research networks where there's a research network here and here and here, and maybe you want to combine then your data because you want to really get enough of a subpopulation, for example. There are database networks where usually this is in electronic health records or registries where a number of places have databases of information, and they get together and try to put the databases together. Practice networks, you're probably familiar with these. These often form around a hospital or a corporate entity and the electronic health records so they can share data and share referrals and move patients through the network fairly smoothly. Communication networks, of course, where you just are sending out communications. Sometimes it's 2 ways, but often it's mostly a node, and the communication goes out from the node of the network. And then there are learning networks. Learning networks is something that ARC has done a lot of work on, and they're really very valuable. So I'd like to spend a few moments talking about learning networks. Learning networks are groups of people who share a concern, a set of problems, or passion about a topic, and who deepen their knowledge in this area by interacting on an ongoing basis. And you see the emphasis on with the underlines. They are set up primarily for the purpose of increasing knowledge. Excuse me while I do my Mark Rubio imitation. Here are some examples of types of learning networks. There are practice-based learning networks where there are similar jobs. And one of the interesting things about people in similar jobs is that there's varying levels of expertise. So in a learning network, this is very nice because the novices can learn from those who are more experienced, and those who are more mature in the job can be energized by the novices. There are task-based learning networks that are focused on an initiative or a problem or an issue. You know, maybe you have, maybe you want to learn about the ACA, and you set up a learning network in your local schools of nursing. And once that task is done, then the learning network goes away. A long-term commitment is the ones that are knowledge-based, and the whole idea behind a knowledge-based learning network, this is sort of the ultimate learning network, is to build a knowledge domain. So here's what it looks like. There are regular interactive meetings. My colleague who works primarily with learning networks, who happens to be a nurse, suggested to me that the in-person meeting is essential, particularly up front. Because building relationships is so important. And we see that here at this meeting. That's why we come to this meeting, is so we can meet people. But then there are web and or teleconferences. There may be an extranet or a discussion board or some sort of venue so that the communication, the learning can be ongoing and interactive. There is an element of formal training sessions. They may be general across the board. They may be specific to a particular region or institution. But in any case, the learning resources are shared. It can be challenging if you need to develop a lot of resources, so it's often a good idea that the training resources already exist or can be easily adapted. And also if the resources can be applied to a more general audience so that you don't have to individually tailor them. These probably sound familiar to you since many of you are in teaching type positions or have been in that kind of position. So some of the lessons learned that my colleague shared with us is that it takes time to achieve trust for two-way exchange. And I'm sure you all understand this. You have to get to know each other first. So sometimes having a time-limited commitment can help the momentum. If you know you have a certain time frame in order to get your training done, having your discussions done, that will encourage people to move along faster. Implementation can be hard because, at least initially, members need a lot of technical assistance and support. And while you're setting it up, it's difficult to know exactly who is truly going to commit to this and who says, oh, this is a really great idea, and then suddenly they're never there, or they're always busy. And then obviously large calls or large interactions don't allow for a lot of interaction, which is where it's most helpful to have a learning network. So the three big lessons are: learning networks are best when interaction is needed to promote product use and assist with implementation. And if you have a steering committee or a champion to be able to keep this moving along, that's really important. Learning networks require members to interact in order to be effective. It is not passive learning. In-person interactions just cannot be simulated. And learning networks can take time to be successful, but once they are really valuable. So, action items. This is a difficult one. I'm not going to say to you, go set up a learning network, because it does take resources and time. But if you decide this is something that's interesting, then I really encourage you. So one area that you might find some inspiration is in your rig. If you have a particularly active rig that wants to and has momentum and an area of interest. Or maybe there's a network nearby that you could visit and just kind of log into for a while. Always, I keep saying this, right? Remember your outcome. What is it that you need to learn to promote, to impact your outcome so that you don't waste your time and waste other people's time learning things that may be very interesting but really don't apply down the road. And then our last area is expanding. Expanding is talking about networks. So what I'd like to do is talk about expanding it with some two other sort of venues. One is with stakeholders. Nurses are not very good at incorporating stakeholders into their research. And who are your stakeholders? Do you even think about this? This is your patients. This is your staff nurses. This is the physicians. This is the pharmacists. This is the hospital administration. This is the clinic administrator. It may be the billing person at the clinic. Anybody who will be impacted by your outcome is your stakeholder and can give you valuable information. Engaging stakeholders is right now a big deal. We're doing a lot about engaging stakeholders in the federal government. Just about every agency I'm aware of is doing something because it is so valuable. It's very uncomfortable the first times you do it because you need to perhaps train the stakeholders about what it is you're doing, or give them some sort of orientation as to why you're asking them for their input. But in the end, it can improve your research quite a bit, and I think by now you've probably read through all of these, so I won't read those for you. Oh, good, you can read this, right? This is a really ugly slide, but it shows you the points that I've experienced stakeholder input from a variety of stakeholders, and where it's been really helpful. And so you can see from this that there are many opportunities for you to get stakeholder input and for it to be helpful. Doesn't mean you have to get stakeholder input at every point, but there are lots and lots of points. And the more you get used to it, the more you do it, the more you'll be able to harness that. Sorry. Sometimes you want your stakeholders to do more than just give you input. Sometimes you want there to be give and take. Sometimes you want there to be more sharing of information, or they have a vested interest in what you're doing, and you want to take it a bit further. This is a model that a colleague of mine in the communications department gave us that is a lighthearted way to think about the steps of developing a partnership, and it's kind of like dating. So first you have this introduction. You're showing off yourself, showing your assets. You're trying to figure out if you're a good match, right? Then you decide you're dating. You have your first date, and you identify your mutual interests. You start asking engaging, interesting questions, and you think maybe there's something here. Then you go on, and one of you says, yes, let's do this. And you acknowledge the relationship. Yes, I went on a date with them. Let's do more together. Let's go on a second, third, fourth date. And even though if you're the one who ask for the first date, you're probably still the one who's calling, even though the other person has acknowledged it and is starting to get engaged. But finally you get to this sweet spot where the partner suggests ways for you to collaborate, and the partner starts to carry some of the responsibilities. I see some of you chuckling. You're thinking about some partnerships where this hasn't happened yet, right? And then finally you get to the good as it gets, where there is meaningful interchange. So this shows you that engaging, developing partnerships, it is a process, and it can have many steps, and you might go backwards even though the arrows don't show that, but you get the idea. So the lessons learned here is that if you're developing a set of partners, bigger is not always better. Slow and steady usually wins the race. Don't push, the person you're dating to move along too fast. Listen, engage, connect. Individualized attention is much more interesting than cattle calls for groups of partners. Think creatively. Don't always look for partnerships just with nurses. And please be mindful of cultural appropriateness. And so here's your action items on this last area, which is to find where engaging stakeholders can be helpful to your work. Get inspired. Talk to your rig. Maybe there's some ideas there. Get out there to see what's available. Find examples of good partnerships. And when you're thinking of your outcome, think about where you share an interest with a stakeholder or a potential partner regarding your outcome. So we did it. We talked about all 5 areas here. How can we then put them back in order as one theme and perhaps even some inspiration to go forward or some action to go forward? So you can see these 2 big bullets look familiar. These were action items on every single one, just tailored a little bit. So let's talk first for a moment about finding the core significance in your work, getting inspired, getting out there. Try to interject this is just advice from me. Try to interject some innovation into your work. Understand the current healthcare environment, please. Be honest about what you need to learn in terms of your knowledge base and about what data you should be collecting. Where or should you become part of a network? Who are your stakeholders and potential partners? And note all along the way how important relationship building is to these efforts. And then the second action items was to keep a focus on your outcome. An outcome is not what you do or what you accomplish. It is not a publication or grant dollars. It is not even guidelines, toolkits, or interventions. An outcome of nursing care is changes health care or changes the health as a result of the nursing care. And so that outcome, whatever it is that's of interest to you, what is the context of that outcome, and how will health care be changed because of your research? So through nursing research, we can expand networks of nursing knowledge. We can implement innovative health care. We can improve health care outcomes. Nurses can do it. You can do it. We can do it. Thank you. So I understand we have time for comments and questions? And I will be here through tomorrow after the luncheon. And I'm going to take the prerogative of standing up here and introduce my colleague, Kish Wadnawani. Kish, would you stand up? I brought my Director of Scientific Review with me. How cool is that?
Questions or comments? Okay.
I was real interested in how you talked about how nursing needs to lead in this, and we've not taken the lead. So what suggestions do you have for us to take the lead?
So the question is that how can nurses take a lead in some of these efforts? I would say that through relationship building, creating some sort of connection with someone else who would be leading these. Dr. Broom last year very carefully used the word co-lead. I think that is very important. I think through multidisciplinary collaboration is how you'll learn or find the inroads to find the leadership. I would never hesitate, well, you can hesitate if you want to, but pretend not to hesitate to invite yourself to things. So if there's a meeting, if there's a network, if there's a project that looks really interesting to you, contact the leader of that and say, this looks really interesting. May I come attend one of your meetings? And then this whole process of networking and relationship building will begin, and you'll be on your way. Yes. Hi. Okay. So question is that that many of the innovations awards are big, or huge projects, and we tend to think small and start off with our little pilot project and move on, et cetera, et cetera. And so how can we strategically think big? Again, I think it's in leveraging networks and keeping an eye on the outcome. I just can't say that enough. I've been through 3 exercises lately in 3 different scenarios, only one of which was nursing, where over and over again we were asked to define our outcome. Don't tell us just what you do. Tell us what's going to happen as a result of what you do. So that's sort of a big way of thinking. And I think that's a useful way of thinking. Think about remember when you applied to nursing school, do the applications still say, I want to help people? Right? Do they all still say that? And we wanted to do that. And, you know, there was a point in my career when I thought, oh, that's so naive, and isn't that cute? But a lot of us here, most of us here now, have the maturity and I dare say the responsibility to actually go back to that goal and try to help people, to help patients, to change healthcare. And we can do it. Now, thinking big is not something that comes naturally to us. So it may be that it's something that you need to find somebody else who thinks big and be willing to, at least initially, take a second chair. But I think finding people who already know how to do it and engaging with them will help. And you probably have a connection to some of these people, and you may not realize it. You know, I saw that the CTSAs got together this morning. I mean, that's a natural avenue. There are other networks inside your institution where you could do that. Now, I know that's not a terrific answer. It's one that requires some additional thought, so I am going to think about it some more and cross paths with me again.
Other questions? There was a person up there. Go ahead, stand up, please.
Well, the RFI for big data training is coming out of NIH, and I'm at ARC, and so I'm not that familiar with it, and I don't know if our colleagues from NINR. It's coming out of NCI. I brought the notice, but the idea, and I'll post it up on the board. There's a board down by the front desk, right? I'll post it down there for you to look at. As well as, oh, I can't believe I didn't say this, our summer fellowships for ARC are open now through March 3rd. But the idea is that there are these massive amounts of data that are being generated, and we don't know, not everyone knows how to analyze these data, and they're completely overwhelmed by it. It's overwhelming to think about. And NIH is going to do something about this and come up with some training, I think, for different methodologies. At ARC, we've done a little bit with networks of networks, sharing of databases, and it's just a lot of work, a lot of data cleanup, for example. So methodologies need to be developed, and so this is a request for information about how to take next steps forward. So.
Thank you, Dr. Collins Sharp. That was a very invigorating. I'm so glad that you were able to pull in some things from Marion's talk last year and kept keeping us inspired. Stay tuned. We're working on the theme for 2014, and I think that you all will find it very magnetizing. So I'll drop a little hint out there in terms of magnetizing research and possibility. That may not be where we're going, but we're headed in a good direction. We are now going to be finishing this session, moving on to the poster session, and then after that, the general sessions. Don't forget your RIG meetings. Don't forget at the back we have the Louis Vuitton bag and the mini iPad, and you may purchase your tickets from me, not Leanne. You may purchase them from any board member. We're all going to be eagerly selling them. Thanks again. Let's give Dr. Beth Collins Sharp another round of applause. She'll be available in the funding, networking with funders, and also thanks so much to our sponsors. Have a great conference, and I'll see you all around.